What are leads and electrodes for neuromodulation? Imagine a tiny bridge connecting your nervous system to a device that can influence how your brain or nerves work. That's what leads and electrodes do in neuromodulation. They are the key parts that make these advanced systems work. Electrodes are small, conductive pieces that directly touch nerve tissue to send electrical signals. Leads are the flexible wires that connect these electrodes to a controlled device called an implanted pulse generator. In brain treatments like deep brain stimulation, electrodes are very thin probes. They are carefully inserted into specific brain areas to target certain nerve cells. These electrodes send electrical pulses that can calm overactive brain activity or stimulate underactive areas. This helps manage conditions like Parkinson's disease, epilepsy, or dystonia. The electrodes are designed to be very precise, so they only affect the intended neural circuits. Leads act as the link between the electrodes inside the body and the pulse generator outside. They run under the skin from the brain or spinal cord to a device usually placed in the chest or abdomen. These leads need to be flexible enough to move with the body but strong enough to avoid breaking. Some leads are inserted through small needles, making the procedure less invasive. Others requiring open surgery for placement, especially for larger or more complex electrode arrays. Electrodes come in different shapes and sizes depending on where they are used. For example, some are tiny wires that pass through the skin, called percutaneous leads. Others are larger, flat arrays called paddle or grid electrodes, which are surgically placed on the brain or spinal cord surface. Advances in electrode design aim to improve how accurately they stimulate, reduce the amount of electrical current needed, and lower side effects. Focused stimulation helps target only the problematic areas, making treatments safer and more effective. In practical use, such as deep brain stimulation, the electrodes deliver controlled electrical pulses to modify neural activity. The pulse generator adjusts parameters like pulse frequency, amplitude, and duration. These settings influence how the brain responds, either calming abnormal activity or boosting desired signals. The stability of contact between the electrodes and neural tissue is vital for consistent results over time. From a neurotechnology perspective, leads and electrodes are the critical interface between electronic devices and the nervous system. Their design and placement determine how well neuromodulation therapies work. Researchers are constantly working on better materials, shapes, and surgical techniques to make these components more biocompatible, durable, and precise. This ongoing progress helps improve the quality of life for many patients by providing more effective neural stimulation options.